All right, we're going to administer Mary's packed medication right now. Now, to administer packed medication, you're going to obviously need the medication in the pack. You're going to need the signing sheet here, like that. You're going to need an individual pill bob because every client at Activ needs that. It's to avoid contamination. And you may need, you don't necessarily need one of these, but a cup to pop the tablets into afterwards so the client can actually take them either from the cup, either from a spoon, from their hand, or from a kitchen plate. And obviously you're going to need a glass of water. Now Mary, when I do my checks for Mary's packed medication, I actually use a few checks to check for client, that I've got the right client. First of all, I check images. So there's Mary there, there's Mary there, and here's Mary here. Now in real life, I actually would not administer this medication because they don't all match up, all right? You look much better. I would also then go, I'm going to pretend today for our demonstration purposes that it does all look the same. Now I would then go to the name, Harrison Mary, Harrison Mrs. Mary, and I would actually look on the back, and if I'm going to deliver this medication, which I'm going to pretend now it's Tuesday morning and this is the medication that she's going to have, I would go to that blister on the back and make sure that it actually says Harrison Mary, which it does. Now in some parts of Activ you will find that this medication isn't labelled on the back of some of the pharmacy medication packs that you'll get. Usually it's in the remote, like, you know, Esperance or somewhere down there. You might, Albany or Bunbury, they have different chemists, and so they might have some slight differences in their pharmacy documentation and also in the way their packs look. Okay, but basically I do 3 checks. I'm also going to, as I'm thinking about the client, make sure that I am aware that she's allergic to oranges and penicillin, which it says there, and I don't think it says it anywhere else on the pack. Right. Now, what tablets am I going to give her? I'm going to give her breakfast tablets, Tuesday morning. It's now Tuesday morning, and the tablets here say Epilum, Renatec, Voltaren. The dosages are Epilum 500, Renatec 10 milligrams, Voltaren 50. I would then go up to breakfast here, 1, 2, 3 tablets, and they are the same there, and it's lilac, rust and pale brown tablets I'm looking for. I would look here to see if I had lilac, rust and pale brown tablets. And what I've got here is a contraindication. And in real life, I wouldn't go ahead. That's a good reason not to proceed with giving medication. Obviously, something's wrong with these tablets and they may not be the correct ones. The pharmacist might have made a mistake. But there are 3, and today for this demonstration purposes, I want you to pretend along with me that we're looking at lilac, rust and pale brown here in this blister. I would then check over the back where it says Harrison Mary, breakfast Tuesday, Epilum 500 milligrams, Renatec 10 milligrams, Voltaren 50. Does all the documentation agree? Yes, it does. So I've got right documentation, I have the right time, the right route, the right dose, and my medication is correct for this demonstration purposes. So I'm good to go. So Mary, here's your glass of water. Now, if you've never seen a pill bop, it's got a serrated edge here, and it's for the purposes of actually piercing the blister like that so that you don't have to touch anything. The pills will drop into the pill bop. You then can pop them either into Mary's hand or into a cup. And what I'll do is I'll put them into this little medication cup from which Mary can take her tablets. So here you are, Mary. Okay. So what you have to do is you have to wait until you're pretty sure that Mary has ingested all of these tablets. Now it's very important that you realise and understand that there's 2 tablets that are not supposed to be chewed. So today I'm going to pretend that we are not watching Mary Chew her tablets. All right, right there. Okay. So how are you going there? Yes?
Yep, they've gone.
Good. Okay, so now I'm going to find where it says Tuesday breakfast on here. It will have the correct date. This form won't have it, but if you were working in a real situation, it will have it. Before you sign here, you need to check one more thing, and that is that your name and sample signature have been written on the back. And in this case, I need to write my name here and put my sample signature, just like that. And then from there, I go over and I find Tuesday, which would be the correct date here, breakfast time, and I sign here. And that's the completion of that task. Now, following that task, there is one more thing you need to consider, and that is monitoring. Now, as you know at Activ, having discussed the rules with you earlier, we need to monitor our client. Now, Mary's having epilim, which is for epileptic seizures. Tell me what you think I would be monitoring Mary for. If you actually said or had the thought that, yeah, I would be looking at the number of seizures, that's exactly what I would be checking. When you monitor a client in Activ, it's not like you have to be a nurse or a doctor. You don't have to know side effects or adverse effects or anything to do with that epilim medication. What you have to know is what you would want to know if you were taking the tablet yourself. Is it working? So how do I know if this tablet's working? Well, Mary's epileptic seizures would either stay the same or they would get less. All right, so therefore that medication would be working. If those epileptic seizures increase, then I know I have to contact the doctor. She's also on Renatec, which is a blood pressure drug. If you don't know what that medication is for, then you actually have to know, and at Activ, we insist on everybody knowing exactly what the medication is going to do to that person so that they know what to monitor. Now, if you're giving a client a tablet that will lower her blood pressure, and all of a sudden, as you're giving it to her regularly, she starts to faint when she stands up and is falling over a lot, don't just assume, oh, she's getting a bit fragile or she's old or whatever. It could actually be the medication is lowering her blood pressure too much. So that's what you would be monitoring for her, that she's just generally got good balance and is staying healthy and well and doesn't faint and pass out when she stands up. The other thing at Activ, the other medication that Mary's on from this packed medication is Voltaren. Now, Voltaren is an anti-inflammatory medication. It's quite strong. So therefore, Mary is having it because she's got pain. Make sure you know what the kind of pain is that Mary has. When you administer the Voltaren, say to Mary, Mary, how's your pain?
Oh, it's really bad.
Okay, so you give that to Mary, give her the Voltaren. You must come back an hour later and you say to Mary again, and how's the pain now?
Oh, it's much better, thanks.
Oh, good. Now, if Mary doesn't have a verbal response because she can't talk to you, then what you want to pay attention to is she restless? Is she agitated? Are her facial expressions, hard? Does she screw up her face and that sort of thing? And then after an hour or so, she should have much more relaxed facial expressions, be a little more cheerful and a little more relaxed. And that's the purpose of the Voltaren. And what you need to know is it working? Because that's exactly what your doctor wants to find out in regard to your client's medication. And you're the one to tell them. So thank you very much and good luck.